Well, Kalimera, good morning. Thank you, everyone. First of all, really appreciating the invitation. It's always a pleasure to be with you, particularly to commend The Economist for taking forward this conversation and particularly for bringing together so many and relevant stakeholders. Also, I would like to take a minute or couple of seconds to congratulate all the women in the room because it's the International Day of Women today, so congratulations for that. It would be good to have more women in the panel, but maybe next time. But in any case, as a man, I would like to congratulate you. It's a very important day, I think. We all know it was said before, cancer is a leading public health challenge, not just in Greece, in Europe, globally. Addressing it effectively really depends on having really a good plan, a roadmap if you like and if you prefer, because it's really about making sure that we can coordinate, that we have a systems approach, that we have integration, that we really combine prevention, early detection, high quality treatment, and palliative and long-term care all together. This is maybe the elephant in the room, is a difficult thing, bringing all of this together. We can't just do one part very well. I think it's obvious for everyone. We have to do more on every dimension, particularly starting with those which are really around prevention. I will talk more, of course, about that because it's very important. It's also about ensuring quality of care. Quality of care in cancer has a wide variety across European countries, and therefore we really need to focus more on quality and particularly on outcomes that matter to patients and their families. So this care needs to be safe, effective, people-centered, and equitable. It's not always the case. So any action plan really needs to deal with this, and I know that so many efforts. I commend Greece and the minister for the steps taken in the last years, having elements of an action plan, having a cancer registry, having a very good screening program. These are really steps in the right direction. But we all know that more needs to be done, no doubt. And we still have gaps. We still have gaps on prevention, on screening, and in terms of treatment access. This is why a cancer plan is essential to provide the structure and the evidence-based response. In these plans, quality of care and patient safety are central. When it comes to cancer, this is probably one of those conditions where quality of care has a wider variation and really requires a lot more attention. We know that the complexity, the opportunities to be working more on personalized medicine or using genomics or using the potentials of AI and all of that makes it even more difficult to address issues of equity and to address issues of quality. Therefore, we really need to do more there. As we advance the technology, the innovations, these innovations are not just about new genomic treatment, new medicine. They are also about social innovation to tackle issues related with cancer, like well-being of patients, like patients that are recovering from treatment, as it was very well pointed out before. Innovation is not just about technology. Innovation is also about the way we deal with this in a social way, in a more equitable way. Needless to say that if you think about smoking, this is the elephant in the room. Your adolescents in Greece are using more and more vaping. Greece is one of the countries with the highest smoking prevalence. This has to stop. I went to a bar with my team the other day. It's forbidden to smoke, but all kids were smoking. Vaping, by the way. We need to target the tobacco industry hands-on. This is important. It's unacceptable. Drinking is still an issue, although Greece drinks less than other southern European countries, but still there is an issue with drinking. Obesity, you have one of the highest prevalences, actually the second on childhood obesity in all of Europe, only beaten by Cyprus. You have a very good plan, a lot of work being done, but we need to keep an eye on the ball. And this is very important. Obesity is related at least very clearly with 8 cancers, some of the most prevalent and pervasive. So we know I have to do more there in the areas of prevalence. Levels of physical inactivity also tremendously high here. So it's really about, the question for me is, can we take a comprehensive approach? Can we do all of this like an orchestra where everyone needs to play in the same way so that we have a very nice, elegant final result? For me, that's the main question. That without addressing the issues, for example, of smoking, you can throw all the money you want in treatment. It's never going to be enough. Thank you.